In Ontario, as in other provinces, patients and their healthcare providers often struggle to get access to specialists. To improve doctors' access to specialists, a team led by clinician researchers and an information technology expert created a secure online platform called Building Access to Specialists through eConsultation, or BASE.
BASE is to allow primary care doctors access to specialist advice without having to send their patients to see the specialist and be able to do it electronically through an eConsult.
If I had to refer somebody to a dermatologist or cardiologist, any one of the specialties who we have included on our service, you're normally going to wait, unless it's an urgent problem, you will be waiting several months for that visit.
So our wait times in endocrinology are up to a year for non-urgent cases. So in discussions with one of my primary care colleagues, we say there's got to be a better way than having patients wait. And we were feeling that patients were coming needlessly, that they didn't need to wait a year to come and see us, that we could have addressed this in a much easier, faster way just by communicating with the primary care doc.
To use BASE, primary care providers log on to our secure application where they can choose the desired specialty from a drop-down list, then enter some basic patient information and write a message describing their question. Images or other additional files can be attached if needed. Specialists receive a notification by email and then can respond by signing on and submitting their reply. Although specialists are asked to respond within a week, the average response time is only 2 days.
As family physicians, we're extremely busy just seeing our day-to-day patients, and to get in touch with a consultant, specifically an individual consultant, to call them on the telephone is often difficult. It's playing telephone tag, and they call you back while you're in the middle of a busy clinic because they're in the middle of their busy clinic and they want to discuss a patient.
There's no doubt there's a lot of what we do is patient physical examination, which is very difficult to duplicate in an electronic format. But we do have images and electrocardiograms that can easily be interpreted and looked at, and blood test results that don't necessarily require the patient right in front of you.
Currently, 751 primary care providers across Ontario have signed up for BASE, with more joining every month. These providers can refer patients to 70 different specialty groups, the largest menu available from such services worldwide. Over 8,000 cases have been completed. In over 2/3 of these cases, patients were treated without needing a face-to-face visit with a specialist.
To be able to, within less than a week, have an answer, the next step, it gives the patient security, it gives them confidence in me as their family doctor. It makes me feel good as their family doctor that I'm able to provide their care. And I think it's just good for the patient-physician relationship.